Okay, hi everyone. Hello. My name is Gwen Driscoll. I am the Director of Communications here at the UCLA Center for Health Policy Research. It's a pleasure to be back here at the center after several months where we've been partnering with our parents, the UCLA Fielding School of Public Health, to have seminars up at the school. But it's nice to be home and to talk about a topic that I, for one, alas, am too familiar with, which is added sugar in our foods. However, before we begin, let me just talk to you about next month's seminar. California has 12 county hospital systems and 5 University of California public hospitals that deliver the majority of the inpatient and a significant amount of outpatient care to Medicaid patients in the state. In this June 28th seminar, Nader Porat, the center's Director of Research, will discuss findings from a comprehensive evaluation of a major effort to promote innovation and improve care at these hospitals, the Delivery System Reform Incentive Payment Program, or DSRIP for short. California was the first out of several states nationally to implement DSRIP, making these findings significant to the broader national experiment in health system reform. Porat, who was the lead evaluator of the 5-year California DSRIP program, will discuss newly assessed measures of progress, what interventions were the most successful, and whether a pay-for-performance incentive system worked. So please join us on June 28th at noon. All right. As for today's seminar, it will be placed on our website at the address you see at top. If you go to our newsroom, just look for center videos and you'll see it. We usually disseminate our slides. We cannot disseminate our slides today as many of the research findings are still in process, but we will be shortly disseminating video highlights of the meeting. So please stay subscribed to Health Policy News, the center's monthly popular e-newsletter, and you will get an announcement about those video highlights. And you can subscribe to our newsletter at this address you see at the bottom. Please also note we will have a brief question and answer period at the end of today's seminar that I will moderate. All right, now to today's seminar. The American Heart Association recommends women consume no more than 24 grams of added sugar per day, and men no more than 36 grams. You might think this would be an easy standard to meet if you avoid the usual suspects, such as the 39 grams of soda in a cola, but you'd be wrong. A single cup of low-fat yogurt can contain up to 47 grams of sugar, which is 12 teaspoons. There are 37 grams of sugar in an Odwalla Original Superfood drink. And there are 60 grams of sugar in a small Jamba Juice banana berry smoothie. So, on May 3rd, the UCLA Center for Health Policy Research invited 33 experts from across the nation to come to Los Angeles for a day-long discussion of why excess sugar poses a health risk and how to take excess sugar out of our daily diet. The coordinators of that meeting, Dr. Susan Babey and Dr. William McCarthy, are our speakers today and will report on some of the key findings coming out of this historic roundtable. Sue is the co-director of the center's chronic disease program and a senior researcher who has published influential studies on the link between sugar-sweetened beverages and obesity, on the disproportionate number of fast food outlets to healthy food outlets in disadvantaged neighborhoods, and much more. Her original research really did help to propel what is now a national conversation about soda taxes and sugar warning labels. Bill is an adjunct professor in the UCLA Fielding School of Public Health and a researcher who has devoted most of his 30-year career to intervention studies designed to encourage members of particularly vulnerable populations to adhere to recommended dietary and physical activity guidelines. He co-directed the UCLA Center for Population Health and Health Disparities, which focused on reducing heart disease risk among the mostly immigrant Mexican-American residents of East Los Angeles. He has chaired regional and state committees on nutrition and wellness for the American Cancer Society, as well as a health advisory committee for the Santa Monica Malibu Unified School District. And I just want to add that Bill has the sartorial distinction of wearing more fruit and vegetable themed neckties than any other faculty member, I believe at UCLA probably. Yeah. So we're very eager to see your tie today, Bill. Yeah. We are also delighted to have with us Brian Raymond, a senior health policy consultant at the Kaiser Permanente Institute for Health Policy. Kaiser and the American Heart Association sponsored the May 3rd Roundtable as part of the first of a series of initiatives to tackle the nation's sweet tooth and some of the major health complications associated with chronic excess sugar consumption, including diabetes, obesity, tooth decay, and on and on. Brian's particular interest is in facilitating these kind of cross-sector collaborations to advance joint action and policy solutions because, as he says, quote, if we are serious about confronting America's most pressing health concerns, we have to look beyond the exam room. It's my pleasure to introduce our speakers, Brian, Sue, and Bill.
Okay, hi, I'm Brian Raymond from the Kaiser Permanente Institute for Health Policy, and it's my pleasure to be here with you today. Kaiser Permanente was honored to partner with the American Heart Association to co-sponsor the May 3rd Roundtable that you're going to hear about today. The Roundtable brought together some of the nation's leading researchers and thought leaders for a discussion about a very important topic. Excess added sugar reduction. Kaiser Permanente values the contributions of researchers like the ones who joined the Roundtable. Research and evidence impacts not just the practice of medicine, but also the health of society at large, and we know that. We also know that there's growing evidence coming out of the past decade that is consistently linked added sugar consumption, excess added sugar consumption to poor health outcomes, including weight gain, diabetes, and obesity. We envision the Roundtable as an opportunity to highlight research that expands the evidence base for strategies to curb added sugar consumption and to explore opportunities for action. And the Roundtable did just that. It was really a historic event. Kaiser Permanente also values its impartiality and objectivity. So I want to share with you an important disclaimer. The views and opinions expressed by the panelists, participating organizations, or their representatives at the May 3rd Roundtable and today's seminar are not those of Kaiser Permanente. Kaiser Permanente does not endorse or support any specific legislative or policy interventions discussed, but supports broad dialogue identifying evidence-based strategies to limit excess added sugar and free sugar consumption. So with that, on behalf of Kaiser Permanente, I want to thank you all for joining us here today to hear highlights from what I thought was a very successful roundtable. And I'll turn it over to Bill and Sue. Thanks.
Okay, so thank you, Brian. And thank you in more ways than one, because without Brian's leadership, none of this would have happened. So we all thank you. I'm delighted to speak to you about a very important public health topic. It's been underappreciated, but increasingly more appreciated. And one example of how this issue has become more important is the very recent, in fact, May of this year, declaration by the Academy of Pediatrics that children under the age of 1 should never have fruit juice. And for infants over the age of 1, fruit juice should be given only in limited quantities. But I'm getting ahead of myself. I was delighted with this roundtable that Brian so helpfully supported, in part because I got to meet all these names that I'd seen over the years, but I hadn't actually met them. And it was almost instant camaraderie, because although we came from different disciplines, as Sue mentioned, they reflected, people from social marketing, people from bench science, epidemiologists, etc. We shared this mission, but we had very different languages that we used to speak of this issue. And just to make sure everybody was on the same page, I made it my mission to talk about what sugar is, because there are different ways of characterizing sugar. So we're going to go through a variety of definitions that you see on the screen. But before we get to that, I want to ask the question, why are humans and other animals so interested in sugar? Why do they have genes for detecting sweetness? Have you thought about that? Well, we aren't sure, but we think that evolutionarily, early hominids were advantaged by having the sweetness gene because they were fruitarians. A lot of their calories came from fruit. And guess when fruit have the greatest nutrient density? Guess when the vitamin C level and the folate level is highest? It happens at the time when the sugar is at its maximum. So animals that had the sweetness gene got more nutrients than animals that didn't. And so the sweetness gene provided a survival advantage, and that's why we're here today. But thanks to the ingenuity of human beings, through their technology, they've taken the sweetness out of where it came from naturally, and they've now placed it in a lot of processed food products where it wouldn't have been there had it not been added. And that's what we now call added sugar. So the natural sugars are those sugars that are dressed in Mother Nature's glory. So examples are the whole apple, the whole banana, the corn kernel, all containing sugar, but a whole lot more, including skin and seeds and fiber and starch. Free sugars are sugars that have been stripped of Mother Nature's glory. Apple sugar, for example, without the apple, otherwise known as apple juice. Added sugars can be natural sugars, such as sugar cane, or free sugars, such as high fructose corn syrup or concentrated fruit juice that is added to other food products that did not originally contain that sugar, such as when fructose is added to peanut butter. Most commercial peanut butters you might see on the label now include fructose. The sugar-sweetened beverages category, as we will see, is a major contributor to our daily added sugar intake. These include sodas, juice drinks, sports drinks. They are noteworthy for including no fiber, typically, and eliciting less appetite control than sugar in solid foods. So if you want to overconsume sugar calories, better to do it in liquid form than solid form. Non-nutritive sweeteners, also known as artificial sweeteners, are non-caloric or minimally caloric chemicals that taste often thousands of times sweeter than sugar. These chemicals include aspartame, saccharin, stevia, and sucralose. At this moment, I would like to point out that a common metric used in the field to characterize the total quantity of added sugar is the fourth bullet on the slide you see before you, namely the percent of total energy intake attributable to added sugars. As you will soon hear, major health organizations have recommended an upper limit of no more than 10% of calories from added sugar, and others have recommended even less, no more than 5%. Eight ounces of fresh apple and 8 ounces of apple juice have similar nutritional compositions. So similar that until recently they were considered nutritionally equivalent. Both were considered to be fruit. To be sure, both are mostly water by weight, with the apple having 84% by weight water and apple juice being 88% by weight water. And both have close to 30 grams of sugar. The major difference, of course, is fiber, which has traditionally been ignored by nutrition researchers as being non-nutritive and therefore irrelevant to energy balance. But the emerging science of the gut microbiome is highlighting the important role that soluble polysaccharides, also known as soluble fiber, what role that plays in nourishing the commensal bacteria in our guts. Well-nourished gut microbes, in turn, play an underappreciated role in glucose metabolism, glucose control, and satiety signaling. The metabolic fate of 8 ounces of fresh whole apple is now recognized to be quite distinguishable from the metabolic fate of 8 ounces of apple juice. They are not metabolically equivalent. And that's why the American Academy of Pediatrics took the motion that it did. So here we have the recommendations from the Dietary Guidelines for Americans. The most recent edition now recommends a limit of no more than 10% of calories from sugar. And the World Health Organization has 2 standards, but it acknowledges that a 5% standard is, in fact, healthier than the 10% standard. And the American Heart Association says forget about the 10% standard. Everybody should be shooting for no more than 5% in order to optimize their cardiorespiratory outcomes. So I think that's it. So on to Sue Babey.
Bill and I are going to be trading back and forth a couple of times. As Bill mentioned, the Roundtable brought together a range of experts, and we're going to do our best to represent their perspectives, but hopefully we won't too badly mischaracterize anything that they intended to present. So I wanted to start off with a word about the influence of the sugar industry in what ideally should be the objective evidence produced by the scientific community. Recently, or relatively recently, several studies have provided evidence that the sugar industry has funded research specifically in an attempt to influence the evidence base. For example, Kristen Kearns conducted an analysis of historical documents that showed that highly respected researchers conducting research funded by the sugar industry downplayed the role of sugar in heart disease and instead singled out the role of fat and cholesterol as contributors to heart disease. Another study examined systematic reviews of the link between consumption of sugary beverages and obesity or weight gain. And they specifically compared studies that reported conflicts of interest due to industry funding versus studies with no conflicts of interest. And they found that studies reporting conflicts of interest due to industry funding were 5 times more likely than reviews without conflicts to conclude that SSB consumption was not related to obesity or to weight gain. So it does appear that this industry funding may have the ability to influence the scientific outcomes. And so there's increasing concern in the scientific community about not just disclosing this influence, but being aware of these conflicts of interest and how they might, not just disclosing the conflicts of interest, but being aware of how these conflicts may potentially influence the results. All right. So a little bit of background about the current state of sugar consumption in the U.S. This graph shows the average daily intake of added sugar among U.S. males and females as a function of age. That's showed by the orange dots. The blue line represents the recommended maximum limit. And as you can see, all the age groups exceed the recommended daily maximum limit. But it varies quite a bit with age, where adolescents are by far the highest consumers of excess added sugar. And after that peak, it sort of drops off again with increasing age. Now, if you're wondering where all these added sugars in our diet come from, the biggest contributor by far is sugary beverages. 47% of the added sugar that we consume every day comes from beverages, so almost half. This is followed by sugary sweets and snacks at 31%. So this includes your cookies and cakes, but also ice cream, those kinds of snacks and sweets. Now, within the beverage category, which is the biggest contributor to added sugar, most of that comes from soft drinks and sugar-sweetened fruit drinks, as well as sports and energy drinks. Those all fall into that soft drink category. Okay. Now, consumption of sugary beverages varies by race ethnicity among both adults and youth. These data are actually from the California Health Interview Survey, since here we are in California. And this shows sugar-sweetened beverage consumption by race ethnicity among children and adolescents ages 2 to 17. Among this age group, the percent drinking at least one sugary beverage per day is highest among Latino youth at almost 50%, just under 50%, followed by multiracial youth and African American youth. And all three of those groups have significantly higher rates of consumption than white youth. Among adults, we see a similar pattern. However, because of the larger sample size among adults, we can talk about a few additional racial and ethnic groups. So among these California adults, again, we see that the highest consumption rate is among Latinos, followed by multiracial adults and African American adults. And these are all significantly higher than white adults. But in addition, we see that rates among Pacific Islander adults and American Indian adults are also higher than among white adults. There were no differences between white adults and Asian adults. Okay. So that was sort of a quick snapshot of what things look like in terms of consumption of added sugar and sugary beverages in particular. Now I want to talk a little bit about some of the evidence linking consumption of sugar with poor health outcomes. So as mentioned earlier, there is a considerable amount of evidence and an increasing amount of evidence linking consumption of excess sugar with poor health outcomes, including obesity, diabetes, and cardiovascular disease. This meta-analysis is one example linking consumption of sugar-sweetened beverages with incidence of type 2 diabetes. This is a meta-analysis that found that a 1 serving per day increase in consumption of sugary beverages was associated with an 18% greater incidence of type 2 diabetes. This meta-analysis is another example linking sugar-sweetened beverage consumption with cardiovascular disease. This meta-analysis included studies comparing high and low sugary beverage consumption and looked at 3 types of cardiovascular events: myocardial infarction, stroke, and other vascular events. This analysis concluded that higher consumption of sugary sweetened beverages was related to a greater risk of myocardial infarction. However, it was not related to a greater risk for stroke or vascular events. Okay, now we're going to talk a little bit about some of the biological mechanisms. I'm handing things back over to Bill.
I'm back. The negative health impact of the pro-inflammatory, low fiber, high sugar, high fat Western dietary pattern on the liver function is cumulative over time as people age. Ideally, if you look at the slide, your liver, looking at the far right, my far right, your far left, should be smooth looking and made mostly of protein. That should last you a lifetime. But for those on an unhealthy diet, particularly one that has too much in the way of added sugar, over time you see a conversion of the sugars to fat, and then you see infiltration of the liver with fat, which then ultimately becomes fatty liver disease. And if that continues to progress, eventually you end up with fibrosis, where the liver no longer functions the way that it should because of the change in the structure of the organ. As you probably know, so one pathway is through the conversion of carbohydrate to fat, but another pathway by which the liver becomes diseased is through the microbiome. So I mentioned the gut microbes as being important in overall metabolic functioning. And it turns out that the gut microbes are very useful in keeping the barrier between the passageway through which nutrients pass on the way to the anus. That barrier is maintained. The integrity is very strong in the presence of fiber, because fiber, as I mentioned earlier, is the primary fuel for the microbes. And the big problem, or one of the problems with a diet high in sugar, is that it also is low in fiber. And I won't get into why that is, but we consistently find an inverse relationship. As sugar goes up, fiber intake goes down. As fiber intake goes down, the microbes get starved. When the microbes get starved, instead of eating the fiber that should have been there, they start eating the host, namely you. And the first thing they consume is part of the mucus lining that protects the host from a lot of the pathogens that are just passing through, hopefully on their way out to the anus without affecting the host. And then you get what's called a leaky gut syndrome. And then the inflammation that results when the immune system is now fighting some of the pathogens that shouldn't have been getting into the bloodstream but now are, thanks to the leaky gut. The inflammation erodes the liver, causing destruction of the liver function and the metabolic complications that result, including diabetes risk and liver cancer. So according to the dietary guidelines, what we should be calling a fiber-rich diet is 35 grams of fiber a day, but typically Americans are getting less than half of that, typically 15 grams of fiber a day. So if we're going to maintain good barrier integrity in our colon, we need to double our consumption of fiber, and that clearly is not going to happen when you have a lot of sugar replacing what should have been fiber-rich carbohydrates. So Maria, no, next slide. So I was getting ahead of myself there. So it was in this slide where we're talking about the gut microbiome, and the word endotoxin that you see at the bottom of the slide refers to the pathogens that should have stayed in the lumen in the passageway of the colon, but instead were leaking through into the host, eliciting a strong inflammatory immune response. So next slide. So this was an interesting study which looked at what happened if somebody on a traditional American diet deficient in fiber and with excess sugar, if you suddenly improve that diet by removing the sugar. And what we find is that, at least in Denmark, Maria Maersk examined the effect of 1 liter per day of a test beverage for 6 months in a parallel group randomized control trial involving 47 overweight adults. And the 4 beverages included sucrose sweetened regular cola, aspartame sweetened diet cola, semi-skim milk, and mineral water. And these individuals were told to drink this 1 liter beverage every day for 6 months to see what would happen. And what they found was a large increase in visceral fat only for those drinking the sugary beverage. And then this last physiologically focused slide, I'd like to point out that it looks like, and this is a study of adolescents in Los Angeles. They were African American and Latino adolescents who had, as the epidemiology showed you, as Sue Babey pointed out in the epidemiology, tends to be higher in the low-income groups. And so there were 3 groups, and this is an observational study, so we can't really make causal inferences, but nonetheless it's suggestive that the top graph shows the adolescents who customarily consumed a low level of sugary beverage consumption, and then the other 2 were medium and high. And on the left is what's called the fullness rating, and this illustrates to me the power of sugary beverages to undermine sensitivity to satiety, and it's associated with a less generation of two satiety hormones. One is peptide tyrosine, and the other one is glucagon, like protein 1. And at least in this particular study, it looks like those who are drinking a low level of sugary beverages ended up having higher satiety signaling. So what that suggests is that sugary beverages are a double whammy. Yes, they already contribute some disease risk by having this conversion of excess sugar turn into fat, thereby infiltrating the liver. But the other way is by reducing appetite for fiber and reducing satiety signaling even when the fiber is present. And so that means that people will keep on eating because there's no satiety signal telling them that they're full. And that's one of the consequences we suspect of excess sugar intake. We were fortunate to have at least one person representing industry. Jessica Smerling is Senior Manager of Nutrition Science at Dannon, and we were happy to have at least one voice from industry to talk about the role that industry could play in reducing excess sugar intake. And Dannon, wanting to be a good corporate citizen and acknowledging the increasing evidence that sugar is a problem, said, you know, a number of our products have sugar at levels where we can safely reduce somewhat the amount of sweetness without jeopardizing their taste, and more importantly for them, not jeopardizing their sales. And so they've been systematically reviewing all of their products, particularly the products consumed largely by children, to see if they could reduce somewhat the sugar content of their products. So the room applauded the efforts of Dannon and other companies like Dannon who are moving in the right direction. But it should be noted that when we look at the amount of fat still remaining in their products, that at least for the Heart Association recommendation, the products are already too high in sugar, even with the lower levels of sugar. And yogurt is probably not the only sugary product that a child might eat in the morning. And similarly, during the day, there's probably multiple sugar products, only some of which may be sold by Dannon. And so when you add all the sugar together, it's well possible that even with these reductions, that Americans are still over-consuming excess sugar if they want to follow the dietary guidelines recommendation of no more than 10%. Finally, I wanted to bring to your attention what I thought was a very user-friendly approach to communicating the message to especially young people, the importance of reducing the amount of sugar that they were consuming. So Sarah Bleich, who at the time of these studies was at Johns Hopkins, said, and she's African American by heritage, and she was focusing her research on how to encourage African American youngsters to consume less in the way of sugary beverages. So she went into convenience stores that sold sugary beverages in Baltimore and persuaded the proprietors to allow her to put up posters communicating messages about the importance of reducing sugar intake. When she put up posters that talked about calories, nothing happened. And she concluded the public really doesn't know what a calorie is, so warning them that they're getting too many calories doesn't do the trick. So one of the posters that she decided to use as an alternative was one where she expressed the additional energy that these young people might be getting by consuming a sugary beverage rather than mineral water or milk. Well, milk is probably not the best example. Mineral water is a better example. When she expressed it in terms of the miles that they would have to engage in, the miles of walking in order to expend the extra energy, then she got their attention, because miles of walking is a metric that they could readily understand. The calorie they don't, but miles of walking they do. And those posters led to an appreciable and sustained decrease in purchases in those stores of sugary beverages by these young people. So she concluded that when you communicate important concepts like excess sugar in terms, in metrics that your community understands, you are more likely to have an impact than if you rely on the usual academic terminology. So, how do you say it? Sue?
Okay, so turning now to some of the policy strategies that were discussed during the day as potential ways to reduce consumption of added sugar. Now, so currently there are school nutrition standards that all public school districts are required to follow. The nutrition standards for sugar, which are part of the smart snack standards referred to on this slide, are still in effect, although requirements reducing sodium and increasing whole grains have been delayed, I guess indefinitely.
No, by 1 year.
Officially 1 year, okay. So, all for these smart snack standards, in terms of the sugar requirements, all of the foods have to meet both a general nutrition standard of containing less than 35% of their total weight from sugar, as well as limiting specific kinds of beverages available, and also limiting portion sizes. Now, these slides were provided by Jamie Shrieky at the University of Illinois, and they've conducted a study of district policies and state laws related to these nutrition standards. And one thing that's important to note is only about 4% of school district policies would actually meet these smart snack standards if the school nutrition standards, the federal nutrition standards, were removed. So only about 4% of schools actually have these standards as part of their own policies, as opposed to either referring to the state standards or directly to the federal standards. This graph compares the percent of state laws and district policies that meet the smart snacks standards for sugar-containing items, specifically at the high school level. As you can see, the district policies are more likely to impose restrictions than state laws. But this is mainly because the districts, more districts than states, actually embed the smart snacks standards, I cannot say that, by reference, by referring to either the federal law or state law. So if, as I said just a minute ago, those standards are rolled back, then very few state or district policies would actually meet these standards by themselves, because most of them simply refer to the federal standards. Now, these state school-based policies do work as intended because they reduce access to sugar at school, they reduce purchasing of sugar at school, and they reduce in-school consumption of sugar. But schools can't do it alone. The actions that actually take place at the school have limited impact on the behavior outside of school. So mainly the policies in effect at schools impact the behavior of kids at schools. And that's why the schools can't do it alone. Additional action needs to occur, or interventions to address the outside of school behaviors as well, as behaviors of adults who aren't in school. Now, a lot of the policy options that are receiving a lot of attention right now focus on excess sugar consumption from sugary beverages. And if you remember, those are the biggest contributors to excess sugar intake in this country. Two policies that are receiving, that are under consideration now, one of which has received a lot of attention lately, include taxing sugary beverages and adding warning labels to sugary beverages. Now, these slides were provided by Maris Ash of ChangeLab Solutions, and what that organization does is they produce model legislation for communities and policymakers who are interested in introducing this kind of legislation as in an attempt to impact sugar consumption. Now, in terms of sugar taxes, several communities have passed sugar tax initiatives, or sugary beverage tax initiatives, including Berkeley a few years ago and San Francisco more recently. But the beverage industry lobbied strongly against these initiatives, and I'll talk a little bit more about that in a minute. So, but in terms of the other legislation that is being debated, and that's the warning label, this is just an example of what those warning labels might look like. And there is legislation currently, I believe it's still active in the California legislature related to warning labels. These are 10 recommended strategies that ChangeLab Solutions has model legislation related to for reducing sugar-sweetened beverage consumption in communities. Now, because their focus is on legislative action, most of these policy strategies focus on limiting access to sugar-sweetened beverages in different locations, at schools and workplaces. Also, there are some strategies related to portion sizes and beverage taxes. But the other side of the coin to limiting access to sugary beverages and reducing consumption of sugary beverages is access to fresh, safe drinking water. And this was one of the topics that came up, and we unfortunately didn't have a lot of time to discuss it. It wasn't the focus of our meeting, but it was raised as something that we should consider more carefully, how focusing attention on making sure communities have access to safe drinking water is sort of a companion to reducing consumption of sugary beverages. Okay. Now, the messaging around reducing sugar is challenging for a couple of reasons. This picture is actually from the SeaTac airport. It was taken in 2014. The photo was taken by Leslie Nicholson of Prevention Institute. And in this picture, you can see that even the best water station has trouble competing with commercially marketed sugar. Hey, can you even see the water fountain? So it's surrounded by an ad telling you that you deserve something better than plain water. Head this way for a big sugary coffee drink. Okay, so the messaging around sugar is challenging for a couple of reasons. One, the public health community often ends up having to, or being cast in this position of being a scold, admonishing individuals to take personal responsibility and drink less sugar, drink more water, eat less sugar. But that frame overlooks the environmental influences that are present in the airport, in our neighborhoods, at our schools, and focuses instead on how Americans are rugged individualists and we do whatever we want, or and we take personal responsibility for everything. The other related to this idea of underplaying the importance of the environmental influences is that the industry has allowed media voice that's constantly reinforcing this idea that it's our choice what we drink and what we eat, and drink more sugar. Okay, so in terms of the debates around the soda tax initiatives that I mentioned just a few slides ago, the Berkeley Media Studies Group did some research on the soda tax debates that happened around the initiative in Berkeley, around the initiative in Richmond, as well as other initiatives that have gone on in California and other cities. What they found is that the industry will take advantage of local nuances. And so this example is from the campaign in Richmond, where the industry took advantage of longstanding community divisions around race. In San Francisco, the anti-tax campaign focused on the high cost of living. And in Boulder, Colorado, it highlighted how fit Colorado residents were. And so obviously they don't need the soda tax because none of them are obese. Now in Berkeley, they used a frame that the pro-tax proponents used a frame that highlighted the industry's bad behavior. And so they cast Berkeley as going up against big soda, which is reminiscent of the campaigns against big tobacco. But it's not clear that this sort of frame would necessarily work in other locations, but it was partially successful in Berkeley, although what was also very important in Berkeley was what was happening on the ground. And that was a wide range of supporters were coming together to do a lot of organizing and work on the ground in support of passing this initiative. Okay, so I think it's back to you now, Bill.
So we can't ignore the role of money in people's food choices. And if you look at this slide from The Atlantic, non-academic journal that I normally reference, it looks like Americans should have no problem getting food because it costs so little. There are reasons to think that this overstates how cheap food is for most Americans. Whether real or imagined, it's very clear that poor, low-income Americans are influenced in the direction of more processed foods. Long shelf life foods tend to be cheaper. And what causes foods to be to have long shelf lives is if they have preservatives like salt and sugar. Those are historically good preservatives. Related to that was some research based on CDC data suggesting that if you compare 2003 to 2010, you find that individuals who are receiving government assistance, nutrition assistance, did not show the decline in sugary beverage consumption that other groups did. And so this led people to assume that getting government nutrition assistance actually seemed to be encouraging them to purchase sugary beverages. Fortunately, a follow-on investigation showed that there's a little more nuance here. Most low-income individuals live in low-income areas, areas that are often known as food swamps or food deserts, where getting perishable foods is hard and expensive, and we're getting a lot of processed food is very easy. That's why they're called the swamp. But for high-income areas, if you happen to be getting nutrition assistance in a high-income area, then it makes a big difference, and you're more likely to make healthy choices. So on the left is the healthy eating index. So the higher the index, the better the quality, the nutrition quality of your food choices. So it does suggest that nutrition assistance is not ineluctably leading low-income folks to consume excess sugar. It depends on the environment that they live in. And this is assuming that high-income areas have farmers markets and Whole Foods markets, supermarkets with plenty of perishable foods. And so I'd like to conclude that it's safe to say that the solution to the problem of excess sugar intake will not come easily and will require input from a variety of stakeholders, but is a problem that has to be solved if we are to bend the curve on the prevalence of obesity-related metabolic diseases, such as type 2 diabetes and fatty liver disease, and if this country is ever going to get a handle on escalating healthcare costs. Thank you.
Okay, thanks everyone. So now we're going to take questions. And for our online folks, we encourage you to write in. The way we do this is we usually take one from the room and one from online, depending on how many questions we have. So any questions from the room?
Thanks so much for the wonderful presentation from the history of why we desire sweets to ending with healthcare costs. So on healthcare costs, obviously information and information asymmetries are important and explain disparities. What's threatened with the ACA repeal? Like, isn't there a labeling in restaurants section in the ACA that could be repealed?
Yes, ironically, that was supported by the Restaurant Association to counter the increasing local efforts to pass menu labeling laws. And the menu labeling requirement of the ACA is limited to calories. And the industry is actually more concerned about having to provide information about sugar, about sodium, which are more clearly linked to disease outcomes. So actually, the Restaurant Association was happy to have the menu labeling law in the ACA with, this requirement that no locality, including states or counties, could overturn this law to improve it. And I'm imagining that the Restaurant Association will make it its business to replace that law if the ACA is repealed.
Okay, we've got a question from online that I'm going to add to. So one of our participants asked, where do we get recipes for infused water? But I think this speaks more broadly to consumer confusion over what is a truly healthy food that I can buy for my family and what is not, because things are being marketed to look healthy, like yogurt, vitamin water, and stuff like that. So what is the advice for the consumer?
My advice usually is consult the dietary guidelines for Americans. They're based on consensus science, and that has, from the first edition to the 8th edition, said eat more fruits and vegetables. And there needs to be an epithet, namely minimally processed. So minimally processed fruits and vegetables are the way to go in order to get the fiber needs met. And if you fill yourself on the stuff that the dietary guidelines recommends, there's relatively little room left for any of the bad stuff. So I tell people, eat as much sugar as you want after you've met the dietary guidelines, knowing that that's not going to happen. Once they've met the dietary guidelines, they're going to consume very little in the way of excess saturated fat or sugar.
Do you have any recipes for infused water?
I don't. Sue?
Bill likes to eat his water, so
in the form of fruits and vegetables.
In the form of fruits and vegetables. But I mean, when I'm looking for a recipe for infused water, I usually just Google it. So I don't have any readily available. Sorry.
Okay. Anybody in the room?
looking at the study on the fatty liver disease, you seem to focus on sugary foods and drinks. Does sugar substitute drinks and foods have the same impact in developing fatty liver disease?
So it turns out, I mentioned two pathways. One was excess sugar leads to conversion to fat. But the other way, it turns out, also is a pathway by which artificially sweetened beverages also contribute to fatty liver disease. And that's where you get insufficient fiber. The body, when it thinks a lot of carbohydrates being consumed because everything is so sweet, then it reduces appetite for any other source of carbohydrate. And as you know, fiber by definition is carbohydrate. So by decreasing appetite for fiber, you end up putting the liver at risk. So even artificially sweetened beverages, because of the mediation of the microbes, leads to fatty liver disease.
We'll let you in because we don't have a question right now online.
So how about like some natural sugar, like honey?
Honey is a processed food. It's processed by bees, not humans, but it's still processed. So honey is not a good example of a natural sugar. So natural sugars typically come with fiber. So the human body is predicated on sugar coming with fiber. So anytime there's more sugar, there's also more fiber. And fiber, as I said, feeds the microbes, which then cause increased satiety signaling. And so there's a natural mechanism for reducing excess intake over time. With Mother Nature, if you go with the dietary guidelines and minimally processed fruits and vegetables. But once you go for the newfangled human processed foods or bee processed foods, now you're in trouble. Honey is a problem. Sorry.
Okay, from online. As a former manager in university dining, I found it very difficult to find lightly sweetened beverages, which is what the customers wanted, for example, in almond milk, bottled coffees and teas, etc. What is it going to take to get more companies to offer healthier alternatives?
The short answer is you got to get the public to demand different products. So I worked for 2 years for the Quaker Oats Company, and they said, oh, we're just meeting consumer demand. But I said, how about creating products that are healthier for a healthier segment of the population, and then show that if people want to be healthier, they need to emulate the healthier members of the population by eating these products. And they said, no, that's too small and niche market. We're not interested. We want to hit the masses. So I'm not sure what the practical answer is. It's a challenge. Did you want to answer?
It sounds to me like most of the laws are being made by 40-ish, give or take, people who are already educated. Is anything being done to check with the group, the 15-year-olds, and ask them what would promote? Why would they change? I mean, if it was me, I'd say get some famous singers and have them start drinking water. But I always worry about that when things come from the top rather than the other.
Mm-hmm. Yeah, I mean, I think that's a valid concern. There is, I think evidence from the tobacco initiatives that a bottom-up approach was really important in terms of getting more places to support these kinds of policy changes that, limited smoking in restaurants and airplanes and, well, airplanes would be federal.
But it's noteworthy, in light of that question, it's noteworthy that in California, it was a bottom-up approach that led ultimately to the passage of SB 19, which was the first state school nutrition bill in the country. And there are now 20 other states that have emulated California. But had it not been for parents and PTAs complaining about sodas in schools, it would never have happened. So, yeah, to the extent that we can mobilize the public to show concern about, milk and sugar in milk in the schools, or about sodas being sold on school grounds,
or water not being available for free for kids at lunchtime.
Yeah, that's another example where we have legislation now that requires schools to offer potable water to kids, but it came about as a result of parents complaining. You don't want the kids to be drinking sugary beverages, but you don't offer potable water. What are they supposed to drink?
Okay, so we're over time, so I'm just going to take one or two more questions. We have an online question. Stevia is naturally derived from a plant. Can stevia be an alternative to sugar?
My guess, and it's related to my earlier statement about artificially sweetened beverages in general, is that if you successfully use any chemical, natural or not, to convince the body that there's a lot of carbohydrate on the way, that tends to depress appetite for fiber. And so it's going to deprive the commensal bacteria of the fuel that they need in order to keep that barrier integrity strong. And then that leads to inflammation, and it leads to metabolic disease. So I don't think any of the artificial sweeteners ultimately are going to be helpful because of the impact on the gut microbiome.
I'm just wondering if there's any studies done that look at the impact of these changing policies in schools and how that affects the sort of drinking outside of the school or in later adulthood. Like, we were developing certain habits, and has anybody looked at that?
Well, so Jamie Shrieky had one study where they looked at the effect of the Smart Snacks standards on consumption of sugary beverages in and out of school, and they found an impact on in-school consumption, but not out-of-school consumption. But that, I think, was a relatively short time frame, and so it only addresses, the immediate impact and doesn't really speak to this habit-forming question or longer-term impact that you were also asking about.
But the American Academy of Pediatrics, as previously mentioned, has come out with a statement, a rather strong statement, encouraging parents not to have sugary beverages of any kind, including 100% fruit juices, for any child under the age of 1, for the purpose that you implied that if you have them well adapted to a diet that doesn't include a lot of sugar early in life, that may extend for the rest of life. And there are reasons to think that might be true, but we need many years to see what the consequences are of this new policy.
Okay, we're going to end with one question from online, which I think is a follow-on to a previous question for you, Bill. What about soluble fiber supplementation?
Soluble fiber in Mother Nature's form comes with all sorts of supports nutritionally that don't exist in supplements. An example of where taking the good stuff from Mother Nature and having it put into supplement form and finding that the result was quite the opposite of what you intended was what we discovered with beta-carotene. Beta-carotene-rich foods like pumpkin, like carrots, of course, acorn squash. These foods were found to be consistently associated with protection against lung cancer. And so, because of the high rates of lung cancer, people at the National Cancer Institute said, we've got to fund supplements with beta-carotene. And so they funded 3 major trials, spent over $100 million examining the impact of beta-carotene supplements. And this after 70 observational studies, epidemiological studies, showing consistently that there's reduced lung cancer risk when you eat orangey foods, carrots and pumpkin and acorn squash. And what they found with the supplement was that they could successfully kill off smokers between 18 and 28% faster with the beta-carotene supplement. In supplement form, it's missing a lot of the other nutrients that accompany the beta-carotene. Beta-carotene turns out to be a carotenoid that it doesn't stand by itself. Typically, it's accompanied by 19 or 8 or a dozen other carotenoids, and it's the other carotenoids in combination with beta-carotene that may have the protective effect. Beta-carotene by itself in super nutritional form is actually dangerous. The dose makes the poison. A little bit may be helpful, but a lot turns out to be dangerous. So similarly, taking fiber in supplement form rather than in Mother Nature's form, I think may be running into some problems. So I wouldn't recommend it at this point. But on the other hand, for some Americans getting no fiber, any fiber is likely to be somewhat helpful to the microbes. But everything else being equal, I say go with Mother Nature, go with the dietary guidelines, try not to use supplements of any kind.